At the beginning of the study, participants reported their average time was about 6.5 minutes. After the study, their time went up to about 11.5 minutes. How long do people normally last in bed? What's average? The average time that someone takes from the beginning of vaginal penetration to the end is about 5.7 minutes. So that's average. So if you're doing that and you're comfortable with it, that's totally fine. However, when you look at surveys where they ask people how long they want sex to last, it's anywhere between 7 to 13 minutes. Well, in medicine, when ejaculation happens sooner than you or your partner want, we call that premature ejaculation. And when you look at studies, you see that about 30% of men struggle from premature ejaculation. However, only 9% actually go see their doctor about it. So how do we define premature ejaculation? Well, there's three major components to it. One is having ejaculation within 1 to 2 minutes of penetrative intercourse. Number two, the inability to delay ejaculation in nearly all sexual encounters. And number three, that this should cause some negative personal consequences like bother, stress, anxiety, things like that are actually causing you distress. That's considered primary premature ejaculation, meaning you've had that problem your entire life. Sometimes people can get what's called secondary or acquired premature ejaculation. And that's when you've previously had normal ejaculatory function, meaning you've had a normal duration of sex, and all of a sudden you start developing a shortened time to ejaculation, usually less than 3 minutes after vaginal penetration. And this is something that may be consistently seen after a certain time period that's causing you bother and is very different from the way you used to ejaculate previously. So what treatment options are available? Well, number one is either psychotherapy or sex therapy. The reason for this is things like depression, stress, anxiety, guilt can really impact the time to ejaculation. So it's important to take into consideration how your mind is perceiving sexual activity with your partner. Fixing these issues with the help of a psychotherapist or sex therapist can be extremely helpful. A next treatment option is called the stop-start method. And what this is when you're getting close to ejaculation, your partner squeezes your penis until the erection partially goes away. You do this about 3 times until you finally allow yourself to ejaculate. Do this continuously 3 times a week until you see that you've increased the time to ejaculation. Sometimes seeing a pelvic floor physical therapist, in addition to doing these treatments at home with your partner, can be even more helpful because they can help you identify the muscles that can potentially control ejaculation. As far as medical therapies, the first line therapy is topical anesthetics. And what these do, they're numbing agents that you put on the penis. And what they do is they actually diminish the sensitivity of the glans penis, so you're getting less sensory information from the penis to the spinal ejaculatory center, hence inhibiting that reflex from going. The first option for topical anesthetics is delay sprays. These are great because you can get them over the counter without a prescription. And my favorite product is Promescent. At the beginning of the study, participants reported their average time was about 6.5 minutes. After the study, their time went up to about 11.5 minutes. Interestingly, they also asked about the rate of orgasm when using this product. And what they found was that the rate of orgasm of both partners went from 44% to 66% after using the product. Moving on to our next treatment option is antidepressant medications. And you may be wondering why exactly antidepressant medications, but it's because they all work on serotonin or preventing the uptake of serotonin. So more of it's around to then work on those receptors that are maybe not responding as well. So you can get more of a delay before ejaculation. Certain antidepressants called selective serotonin reuptake inhibitors or SSRIs are prescribed daily. These are often fluoxetine, paroxetine, or sertraline. These are prescribed by your doctor off-label because they're not actually meant for premature ejaculation, but they have the side effect of delaying ejaculation. Typically, if you take it daily, you will need about 5 to 10 days after starting the treatment before you notice a difference. And that may continue to improve for up to 2 to 3 weeks after you start the treatment. Side effects include fatigue, having some increased yawning, nausea, and some diarrhea potentially, or some increased sweating. But the most important and bothersome side effect is sometimes people notice a decrease in libido, which is clearly not desired if you're trying to improve your ejaculatory latency time or the time before you ejaculate. Usually you'll notice these side effects early on and they tend to disappear after about 2 to 3 weeks, but it is something to look out for. You can also take certain medications on demand, meaning before sex. The first on-demand medication is called clomipramine, and what this is it inhibits the uptake of serotonin as well as another chemical messenger called norepinephrine. This is taken about 2 to 6 hours before sex, and it also has shown significant increase in ejaculatory latency time. Similar side effects to SSRIs, so you need to be on the lookout for those. Another medication is called duloxetine. This one is shorter acting, so you can take it a little sooner before sex, so you don't have to take it 6 hours before, and it works quickly. However, many people get frustrated when taking these medications. They may find that it's not as efficacious as you thought it was going to be, meaning it doesn't work as well, or that they're spending a lot of money, or they're just frustrated that they have to take a medication at all. I will say that if you are struggling with erectile dysfunction or a difficulty getting an erection that's firm enough to penetrate your partner, then you want to treat that first with medications like sildenafil or tadalafil. Typically, treating the erectile dysfunction also helps with the premature ejaculation.